As I enter the room, I'll make sure that the scene is safe and make sure to provide privacy by drawing the curtains close. And I'll proceed to wash my hands using an alcohol gel. I proceed to wear my gloves. Hi, my name is Maverick. I'll be your nurse for today. Can I ask for your preferred name?
Mona is fine.
And Mona, what brings you to the hospital?
I've been feeling quite breathless, like I can't get enough air in. I think I might be at risk of COVID-19.
Right. I'm so sorry to hear that, Mona. We'll try to make you a little more comfortable. Now, for me to do that, I may need to do a full assessment and ask you a few questions. Would that be fine?
Yeah, that's fine.
Right, thank you. Now, I'm wearing protective gear and a mask. I'd just like to ask if you can hear me okay.
I can, yeah.
Thank you. Now, I saw in your notes that you have a hearing aid. Do you have it now?
Yeah, I wear one in my right ear. So we speak into that one.
Thank you. And also, I can see here that you have reading glasses. Are these yours?
Yeah. I just use them for reading.
So you don't need it now.
No, I'm fine.
Thank you. Now we'll start up with doing a quick ID check. Would it be fine if I check your wristband?
Yeah.
All right. And can you mention your full name for me?
Mona Louise Stevens. It's 7th of June 1979.
And your hospital number is 1357924. Thank you. Now, do you have any allergies?
Yeah, I'm allergic to penicillin.
And what happens if you take penicillin?
I get a rash all over my body, and I get diarrhea.
Okay, now we'll make sure you won't get that in your hospital stay, right? Can I check your red wristband real quick, right? So I can see that the details are correct, but I can't see any penicillin written on it, right? But don't worry, after my full assessment, I'll come back and have a new one with penicillin on it, okay?
Okay.
All right, now Mona, are you in any pain right now?
Yeah, my chest and my back are quite sore.
And if you're gonna rate the pain in a score of 10, where 0 has no pain and 10 would be the most painful, what will you give it?
I'd probably say about 2. But if I didn't have painkillers, it's about 5.
And do you want any painkillers right now?
No, it's fine.
No. Okay. Now, if you want one, just let me know. Okay? You want me to reposition you?
No, I'm comfortable. Thank you.
Okay. Now, Mona, we'll be starting the assessment by taking full observations, which would consist taking your blood pressure, your heart rate, your respirations, oxygen saturations, temperature, and your blood glucose, right?
Okay.
But before doing that, let me just check if you need to go to the loo.
No, I'm fine. Thank you.
And have you had any hot or cold drinks in the last 20 minutes?
No, I don't think so.
Okay, that's good. Now, I'm just gonna get my equipments ready, alright?
I can confirm that my equipment is clean, calibrated, and within the service date.
Now, I'm gonna start with assessing your airways. Now, you have been talking to me, which suggests that your airways are patent, but it seems that you've been struggling to speak in full sentences. I'm gonna proceed with a more in-depth assessment of your breathing. Would that be fine?
Yeah, that's fine.
Okay. As I look at you now, I notice that your breathing is slightly labored, and it's kind of faster than the usual, and you're using your mouth to breathe, right? So I'm gonna get your oxygen saturations. In able to do that, we will need a pulse oximeter clipped on your index finger. Would this finger do?
Yeah.
But before doing that, I may need to assess it for any fake nails, varnishes, or signs of cyanosis.
I note that the finger is free from nail varnishes, fake nails, and it's warm to touch but not clammy.
Okay, Mona, I'm clipping the pulse oximeter on your finger now. I want you to stay relaxed, and this may take a minute or so, so just be comfortable, alright? So the time is 5 minutes past 7, and I'm commencing my observation.
After 1 minute, I have counted 30 respirations, and I can also hear some expiratory noise from the end of the bed. I can also see that Mona is using her accessory muscles in breathing, which is consistent with respiratory difficulty.
Okay, Mona, I already got your oxygen saturations. It's at 97%, which is normal. And I didn't tell you, but I also counted your respirations. The result is at 30 cycles per minute, which is a bit high. And the normal range is at 12 to 20, right? So this means we might need to monitor you more closely. Okay?
Okay.
Although saturations is at 97%, she is on oxygen therapy, so we may need to keep a close eye on her.
Okay, Mona. At this time, I may need you to sit forward. Would you be able to do that if I lend you a hand?
Yeah.
Right. Okay. So I'm gonna check your back for your chest expansion. All right.
I am going to use the surface of my fingers and hands to feel for abnormalities. I am assessing for chest movement symmetry, chest skeletal abnormalities, tenderness, skin temperature, swelling, and masses. I will stand behind Mona and place my hands with fingers spread apart beneath her arms. On the side of the chest, about 2 inches below the axilla. My fingers will be pointing towards the anterior chest. This will let me feel the chest wall rising and falling on inspiration and expiration. I will ask Mona to take deep breath in and exhale out completely. I will be looking at my hands and thumbs to see that they have moved equally on both sides. The patient's chest will be auscultated in all 3 areas: apices, mid-zone, and bases, and compared left to right. The same will be done on the back while she is taking deep breaths in and out. There is widespread inspiratory and expiratory wheeze.
Okay, Mana, I've listened to your lungs and I can hear that it's quite wheezy. So what we're going to do now is put you in a more comfortable position, and I'm gonna pop a pillow in your back. This might reduce the symptoms that you're feeling, okay? All right,
Thank you.
is that better?
Yeah, that's better. Thank you.
Okay. According to your notes, Mona, you are on a 4 liters oxygen therapy. Now, I can't see if it's on right now. So, examiner, can you confirm that the patient has 4 liters of oxygen therapy?
Yes, I can confirm that the patient is on 4 litres of oxygen per minute.
I am just going to mark on your chart that you're receiving oxygen therapy via simple face mask, which is a score of 2 in the News 2 chart.
Now, that's it for your breathing, Mona. Okay, at this point, Mona, we'll go on to your circulation, right? I'm gonna assess your skin pallor for any irregularities such as paleness, sweating, and the blue or mottled look, right? I can see that your skin is pink and it's well perfused. Now I'm gonna go on to check your hands and your feet and check their temperature. Would it be fine if I touch your hands? Okay. Thank you. And can I expose your legs for a minute?
It's fine, yeah.
I'm gonna touch it and check for the temperature. Right, Mona? Your hands and your feet are nice and warm, which is good. Right? Now I'm gonna continue by checking your capillary refill. I'm gonna do that by pinching or applying a gentle pressure in your index finger. Would it be fine if I use this index finger?
Yeah.
Right?
I will apply a gentle pressure in the nail bed and release it, and wait and see how long it will take for the blood to come back. I'll also check for any signs of cyanosis, fake nails, or varnishes, and make sure it is warm to touch but not clammy.
So the color went back before 2 seconds, which is good, normal, right? Now I'm going to continue by taking your heart rate and your blood pressure. But before that, let me just check if our legs are uncrossed.
Yeah, sure.
So this might affect the reading sometimes, right? So first do your heart rate, and can I use your left wrist?
Yeah.
Okay. Thank you. I'm gonna check for the rate, rhythm, and amplitude of your heart rate, okay? Or your pulse. Now I'm gonna be quiet for a minute or so. I want you to keep calm and relax, right? So the time now is 10 minutes past 7, and I'm commencing my observation. Okay, Mana, your heart rate is at 81 beats per minute, which is normal, strong and regular, right? So now we'll be getting your blood pressure. Do you mind which arm would I use?
Well, this one's fine.
This one. Yeah. Okay. Now, can I ask if you had any recent trauma or surgeries in this arm?
No.
Okay. Would it be fine if I pull up your
Yeah,
gown? Okay.
Okay, I'm checking for the arm for any signs of inflammation, infection, or redness, and there is no IV, so I'm happy to proceed.
Okay. And I'm gonna pop in the pillow so that it will be more comfortable, and it's right. Now, assessor, I can confirm that I'm using the right size of cuff for Mona. Okay, and I'm gonna put this around Mona's arm, making sure that it's not too tight and not too loose. Yeah, just put it like that. Okay, Mona, you'll feel a little tightness, which is normal. That would get the blood pressure of it. Okay, right. Right, your blood pressure is 141/73. Now, do you have is it a normal reading for you?
Yeah, I think it's usually on that.
Okay.
As part of my disability assessment, I will begin by assessing Mona's AVPU.
Mona, do you know where you are today?
Yes, I'm in the hospital.
And do you know what day is this?
It's Tuesday the 4th of August.
Okay, that's right. And can you please stick out your tongue for me? All right. And can you raise your eyebrows, please? Thank you. And I may need you to put your arms forward. And can you squeeze my hands?
Yeah.
All right. Thank you. All right. So I can say that Mona is alert, conscious, and coherent. And I'll put an alert on the AVPU. And I may not need to do a GCS assessment. And I'm going to put A on the consciousness part of the news too. Now, Mona, I may need to get your blood sugar. Now, I need to draw a little amount of blood in your finger. Uh-huh. And I'll just make sure that my equipments are ready. So I'll make sure that there's a sharps bin and my equipments are calibrated, the glucometer. Now I need to prick your finger, right? This might sting a little, okay? Right. Right. Getting the blood sugar. Okay, Mona, can you use this finger? Yeah, okay. Now your blood sugar result is at 7, which is normal and which is good, okay? Now we'll make sure that all the sharps are placed on the sharps bin and discard the things that I used.
I'm going to move on to the exposure part of the assessment now.
Now I may need to get your temperature. You mentioned about wearing a hearing aid. Do you still have it on?
Yeah, it's in my right ear, but I don't have one in my left.
Okay, would it be fine if I get your temperature in your left ear?
Yeah, that's
Right.
fine.
So can I just give it a quick look?
I'm going to check for any signs of swelling and redness around the ear canal. I'll make sure to use a disposable clean probe and snugly fit it on the thermometer and make sure not to touch it while I'm doing this.
Okay, that seems good. Now, Mona, I'll be using a tympanic thermometer. And I'll make sure to snugly fit it. So we'll use a tympanic thermometer, making sure that there's a disposable probe on. And I will snugly fit this on your ear canal, okay? Right. Getting your temperature. It's 36.9, okay? Which is good, you don't have any fever. Thank you. Now make sure to dispose this probe. Okay, Mana, again, your temperature is at 36.9, and I'll put this here in use to chart. 36.9, right? No fever. Now, Mana, we'll continue with assessing your back, or checking your back for any signs of rashes, lumps, or bumps. Would you be fine if I roll you in your side?
Yeah, that's fine.
Okay.
Yeah.
Okay. Alright. Okay, I can see that your back has no signs of any rashes, lumps, or bumps. Would you fine if I check your legs?
Yeah.
Okay, I'll just expose it a little, okay? Right. And no signs of rashes, lumps, or bumps. I can turn on your side or in front now.
So I'm moving to ample now. A is for allergies.
Now you mentioned about being allergic to penicillin. Is there any other drugs you're allergic on?
No, don't think so.
Mm-hmm.
M is for medications.
Are you on any medications right now?
Yeah, I'm on bisoprolol
Mm-hmm.
and sertraline. I take those daily, and then I've got my inhaler for my asthma, just when I need it.
Mm-hmm. And you don't need it right now?
That's fine.
Okay.
P is for past medical history.
Now, do you have any recent hospital admissions or any like history of illness?
Yeah, I've had asthma since I was a child, and then I was diagnosed with hypertension 2 years ago, and I also have osteoarthritis, so I get quite a lot of pain from that.
L is for last meal.
When was the last time you ate?
Last night I just had some beans on toast. Nothing exciting. I'm not really feeling like eating at the moment.
E is for everything else.
Now, you mentioned that you started feeling unwell. When did it happen or started?
It's probably about a week ago I started feeling really exhausted.
Mm-hmm.
And about 4 days ago I started to feel really unwell, like quite sick and off my food. And then with the pains in my chest and my back, it was just really hard to breathe, and like walking around, I was really struggling to catch my breath. And walking any long distance became really hard, like up and down stairs is really hard. I just feel really breathless, but it's only since I've come into hospital that I feel like it's like I can't get enough air in.
I'm now going to use Socrates to assess her pain.
Now, you mentioned about the aches. Do you still have it now?
Yeah, in my
Yeah.
chest and my back.
And can you describe the pain?
It's like a constant annoying ache.
And does it like radiate to any parts of your body?
No, just in my chest and my back.
So, Mona, when did the aches start?
I'm not sure, about 3 days ago.
And does anything help with the pain?
Yeah, I take paracetamol and ibuprofen, and heat packs really help as well.
So you mentioned that in a pain score, it's 2 with painkillers and 5 without them. Do you need painkillers right now?
I'm okay, thank you.
And if you need one, just let me know, okay?
Thank
All right,
you.
welcome. Now, let me ask you, have you passed urine today?
I can't remember. Yeah, maybe last night.
Last night. And have you moved your bowels?
Yesterday.
Yesterday. All right, thank you. Now, at this moment, Mona, I'm gonna score your News2 chart here. So let me just tell you the results. Your respirations is a bit high at 30 cycles per minute, and you're 4 liters. Oh, sorry. Your respirations is at 30 cycles per minute, which gives you a score of 3, and you're on oxygen therapy, 4 liters via simple face mask, which gives you a score of 2. Now, aside from that, every other observations are normal, within normal range. So I'll calculate your News2 score now. You have a total of 5 with 3 in a parameter, which is your respirations. We'll need to monitor you every hour, and we need to inform the medical team and your attending physician so that they can review your case, right?
This is the end of the ABCDE assessment.
Now, before I go, Is there anything else that is bothering you?
To be honest, I'm a little bit worried about my daughter. She's at home. She's 19 and she's got Down syndrome. But she's not very good on her own. Because she's got a mental age of about 10. So I'm quite worried about her.
Oh, I'm sorry to hear that, Mana. Do you want me to call someone?
Well, my neighbour usually checks in on her, but obviously she can't at the moment with social distancing. So I don't really know what to do.
Well, if you want, I could refer your daughter to the social service for safeguarding. That way, they could pay a visit to your house.
Yeah, that would be great. Thank you.
Okay. So I can see that there are cigarettes here in Mona's side. Usually, I will talk the patient for any smoking cessation, but since Mona is really unwell right now, I'm just gonna do it in some other time. Now, Mona, I can see that you have a walking stick here. I'll just put this in your bedside. That way, you could use this if you want to. Okay. Now, let me just ask you, how are you in your feet right now?
I think I'm quite wobbly because of the breathlessness.
Now, if you want to use the bathroom, just ring the call bell so that we can assist you, okay?
Okay, thanks.
Right. Now, Mona, would it be fine if I refer you to the physio team?
Yeah,
That way we could, they could check your chest and your mobility,
Okay.
all right?
Yeah.
Now, Mona, are you feeling comfortable now?
Yeah, I'm fine.
That's good to know. Now, just to let you know, I'll call on the social service team so that you could put your daughter in safeguarding and they could pay her a visit. And also, we will refer you to the physio team for your chest and your mobility, right? And also, regarding your wristband, I'll make sure to get you a new one with penicillin written on it. Okay?
Okay,
Is there anything else I could assist you?
no,
Right.
that's great. Thank you.
You're welcome, Mona. So I'm just gonna open the curtains now, and I'm gonna dispose my gloves. So I'm gonna wash my hands using this alcohol gel. That'll be palm to palm, fingers interlace, fingers interlocked, back of the fingers, fingers to palm, thumbs, and wrists. And I'm gonna air dry it for 30 seconds. Alright, again, Mona, my name is Maverick. If you need anything else, just press the call bell and we'll assist you. Okay?
Thank you.
Now I'm just gonna go away and clean my equipments. If again, just let us know, okay?
Thank you.
Thank you.